Hello friends, today we are going to discuss about 10 of the most likely questions which will be asking in an interview of an NHS radiographer or in private sector. So we'll be going it through one by one and I'll be explaining it like briefly about all of the questions. So it's going to be a bit long video, so try to watch the video fully, and if you want to take a note of them, take a paper, a pen and just note it down and make yourself throw with it, and you can change it or add on to that questions and answers if you would like, and just go through it. And I think these are the most likely questions which will be asking in an interview. So we'll move on to the questions one by one. Before that, myself is Suchesh and welcome back to the channel Mallu Radiographer. So we'll move on to the first question. Most of them will be asking what are the primary responsibilities of a radiographer. So I have made like 8 brief points for this first question for the primary responsibilities of the radiographers. So I'll go through it one by one. First point will be, as a radiographer, your primary responsibility includes taking diagnostic images of patients using various imaging techniques and interpreting images, communicating the findings to the physician or doctors, and ensuring the patient safety during the procedures. That will be the first point for that. And moving on to the second point, to ensure the patient safety during radiographic procedures, radiographers take several measures such as the following: radiation protection protocols, using appropriate shielding, and minimizing the patient exposure to radiation. So you can elaborate this point a bit more according to your wish. So such as as you are applying for the UK things, just get to know the radiation rules of UK. So country to country the radiation rules will be different, so you can add points to this one and you can elaborate it a bit more. And if you are moving on to the third point, it will be radiographers have experience with various diagnostic imaging techniques, which includes X-ray, CT scans and MRI. They understand the differences between these techniques and indications of each, and how to operate the equipments and software required for each type of imaging. The fourth point will be, radiographers manage patients who are anxious or nervous about undergoing radiographic procedures by explaining the procedure in clear and concise manner, reassuring the patients and addressing their concerns. Radiographers may also use techniques such as distraction or relaxation to help the patients feel more at ease. So you can this one also you can just elaborate it a bit more. Just like if they're asking for a question in CT, you can tell the CT scan will not be taking that much time compared to the MRI. MRI scan will be minimum, it will be taking it depends on the protocols. At least minimum it will be taking around 15 to 20 minutes, as you guys all know. But CT scan will literally take just 5 minutes for a CT head or anything like that. So if you are assuring the patient the scan will be very short time and will be finishing it as soon as possible, they'll be more happy to proceed with the procedure. And in MRI you can do is you can ensure the patient that nothing is going to touch when you are inside the machine. It's only the sound of the machine will be there, and you can play music through MRI system. You can that will help in relaxing the patient a bit. So providing all this explanation will make you more clear in explaining that point. So we'll move on to the next point. Radiographers take several steps to maintain the accuracy and completeness of the patient records and images, including verifying patient information, selecting the appropriate imaging technique, positioning the patient correctly, and ensuring the images are of high quality and diagnostic value. So all these points, this one also, if you're elaborating a bit more, means you can tell if you're verifying a patient, means there will be 5-point techniques, 3-point techniques. It depends on country to country. So the main point techniques will be asking the patient's full name, date of birth and the address. These are the identification techniques. You can elaborate it a bit more. If you are selecting for the protocol things, and just add on something by yourself to this point and make it a bit more elaborated one. And I'll just move on to the sixth one. The sixth point will be, radiographers may encounter challenging cases such as patients with physical limitations or difficult to imaging body parts. To overcome these challenges, radiographers may use special positioning tactics, collaborate with physician to select the appropriate imaging modality, or use additional imaging modalities to get a complete picture. So you can elaborate this one also. Radiographers may encounter challenging cases. The challenging cases might be a dementia patient or something like that, or like an RTA patient who is like very badly injured, who is not staying still for the scan. So we might use the blocking and strapping method in CT, or in MR. If it's a dementia patient, you might ask the physicians or the doctors to get sedated or something like that. So just elaborate all the points according to your knowledge, and like add on to the point, just do some research for this, all these things, and just elaborate a bit more. So I'll move on to the seventh point. Radiographers stay up to date with the current advances in radiography and imaging technique through continuous education courses and attending conference and reading personal journals. So this point is really important, because like back home also, when you are like during schools and like when you are a professional, you will be attending several CMEs. This CMEs will be having a certificate of this. CME is like called as CPD in UK, that is continuous professional development, and CME means continuous medical education in India. So both are like same. So if you have any CME certificates and all, like you can add it on to your profile. You have attended this class or these courses during this time, and you can provide that certificate details also in your resume. And I'll go to the 8th point, and this is the last point of the first question. To prioritize and manage workload during the busy shift, radiographers may use a triad system to determine which patient require immediate attention and delegate tasks to the staff or seek additional. So if you're elaborating this point, you'll get to know that you'll be prioritizing the patients on each cases or the history of the patient. Just like if you have a stroke patient, you'll be doing it that first, rather than some other CT head patient which is like a cancer patient which is already known case or something like that. So prioritize according to the patient history. You can also elaborate this point. The second question is, as a radiographer, how do you ensure patient safety during a radiographic procedure? And the answer for this one, you can answer it as like, the radiographers ensure patient safety during radiographic procedures by following strict radiation protection protocols, optimizing equipment and technique, and communicating effectively with the patient. And the radiographers also take measures to minimize the patient exposure to ionizing radiation, ensure proper patient positioning, and use appropriate equipment and imaging technique for specific procedure. Radiographers also communicate clearly with the patient, providing instructions on how to hold still or breathe during the procedure, informing them of any potential risk or discomfort, or answering any questions or concerns they may have. Additionally, radiographers perform regular quality control checks on the imaging equipment to ensure it is functioning properly and produce high quality images. These measures help to maintain patient safety and provide best imaging results. This one also, you can add your points to that, and you can elaborate it a bit more in details, or else you can point out like specific points, like such as like, if you're like I have told in one sentence, you can just point it out all the important points in that, and you can tell it separately. Just like I have told, like to take measures to minimize patient exposure on ionizing radiation. So in CT we'll be using like lead aprons, everything, and like proper positioning for reducing the radiation dose. And all this you can elaborate it or add on a bit more points by yourself, or do some research on that, and you can add on points to that. And we move on to the third question. They might ask you to discuss your experience with the diagnostic imaging techniques such as X-ray, CT, and MRI. So if you're applying for a rotational basis job, they'll be asking you about all these things. Or else, like if you're applying for just a CT or just an MR job, they will ask you to discuss your diagnostic imaging techniques such as like in CT or in MR. So I'll just point it out one by one, just like in X-ray and CT and in MR separately. So in X-ray, X-rays are used to obtain images of bone and high density structures of the body, and I have experience performing X-rays on variety of the bodies such as chest, abdomen, and experience. So just point out the X-ray experience which you are already having, like you will be working in like back home. So just point out what are the special procedures or the special X-ray which you have experience in, and always just try to include the radiation protection in your answers. So as because like we are changing the country, back home it's not that important to check on radiation safety. We don't bother actually, I think so, because like I've worked out there, because like no one is bothering about the radiation dose over there. But like over here in UK, everyone is more concerned about the radiation dose and the radiation safety over here. When you are replying for an answer for a CT or an X-ray, just try to include the radiation safety on that. First of all, you get yourself used with the radiation safety rules of the UK or whichever country you are moving on to. And I'll go on to CT. So if you're telling about the CT scan is a combination of X-ray, just like X-ray. CT also uses X-ray radiation, so it's also just ionizing radiation. So always try to include the radiation safety things to the CT questions also. It's really important over here. So try to include that. So, and always explain your experience in CT, what you have and what are the CT special procedures which you are doing back home, or like just like biopsy or like any other drainage or the special procedures which you are doing over there, rather than mainly focusing on the routine things. Yeah, that's it, I guess. And moreover than, like, you can include like the administration of the contrast. If you're doing cannulation back home also, you can include that. You already know cannulation. Yeah, and if you're talking about MRI, just like CT and X-ray, just explain your experience in the MRI field. So just tell what, like, explain. If you're starting the answer with, like, you can tell what is MRI and what you used to do over there, and what is your experience in our special procedures in MRI which you are doing, like cardiac imaging or something like that. You can add it on to that. And like, everyone is telling like MRI is safe. Yeah, compared to CT and X-ray, MRI is safe. But if you are like closely looking into, if you are not properly using the MRI machine, it can cause burns and other stuffs. So just mention the main contraindications of the MRI scan. It will help them understand, like, you have already worked and you are used to the MRI scanning, and like you know what you are doing. So mainly, if they are asking you to explain about your experience in various diagnostic imaging techniques, you can just tell like all your experience, and like if you want, you can add it, like do some research and you can add on to some points to this. Over that, like in every modality, you can add on the communication skills as a point, because like communication is a very important thing over here. So you need to get the consent from the patient, each and every patient. So like add on the communication skill which you have, like tell them like you have very good communication with the patient, so you know how to explain the procedures, and like getting consents for the contrast, everything like that. So we'll go on to the next question. So it is like, how do you manage patients who may be anxious or nervous about to undergo a radiographic procedure? So I have made like 6 points for this. So I'll go through one by one. So as an introduction, you can like tell, like, managing patients who are anxious or nervous about undergoing a radiological procedure is essential part of a radiographer's role. So here are some of the points which I can tell you about that. The 6 points which I made is like communication. Communication is the main part of a radiological procedures. So I start by communicating clearly and empathetically with the patient, explaining the procedure, what they can expect, and answering any questions or concerns they may have. By providing a clear understanding of the procedure, and patient can feel more in control and reassured. So always try to like start with communication. Like for all the radiological procedures, if you're dealing with a patient, the main thing is communication. So you can add on something to this point if you're doing some research on that. And the next point will be preparation, and you can elaborate it a bit more. Just like provide patients with clear instruction before the procedure, such as what to wear, whether to take any medication, or how to prepare for the exam. This helps patients feel more prepared and in control, which can help to reduce anxiety. And the third point will be environment. Environment, we are telling about the scan room, or whichever, like X-ray room or the MRI room. So if you briefly describe the environment thing, will be the radiographers will make sure that the imaging room is clean, quiet, and comfortable, and radiographers may provide patients with the blanket to help them feel more comfortable and ensure that the room is warm enough for the patients. As you all know, most of the radiographic room will be fully AC, because like all the radiographic machines require a minimum temperature to be maintained. So some of the patients will be feeling so cold. So try to like give them some blankets or something like that to make them more comfortable. And we'll go on to the fourth one. We'll go on to the fourth one. Fourth point will be distraction. So during the procedure, radiographers may provide patients with the distractions such as music or television to help keep the mind off the procedure. So if you're thinking that point, if like in MRI scans and all, like if your patient is coming with the anxious, you'll be giving headset and you'll be playing music for the patient, which will calm them down actually. And if you are going for the fifth one, empathy means like all the radiographers remain attentive to the patient's emotional state throughout the procedure and take measures to provide comfort and reassurance as needed. If a patient is like so anxious about, most of the patient, you can see like when you're working, like most of the patient, some most not most like some of the patients will be anxious about their test. Like if they are going undergoing for the first scan or something like that, they'll be anxious about whether they got something like severe inside, or like, oh, they might not be knowing what they are having before the scan done, so they'll be anxious about that. So try to calm down the patients by reassuring them like nothing is gonna happen with the scan, like scan will be finishing so fast or something like that. Okay, so if you're moving on to the sixth point, pharmacological interventions. Pharmacological intervention will be like consult with the referring physician if necessary to determine pharmacological interventions such as sedation, which may help for the patients with severe anxiety. So if any patient is coming with severe anxiety, if they are not able to undergo the scan without any sedation or something like that, it's the duty of the radiographers to pass on this message to the doctors who are looking after them, so that like they can get another appointment under any anxiety reducing medications or relaxants. If you're telling all these points, and you can make sure that the patient can manage the anxiety and ensure that the imaging procedure is comfortable and stress-free for the patient. We'll just move on to the next question, and I'll just read it out for you guys. All right, so I just already made it, so like 7 points for this. So I'll go into the question. What steps do you take to maintain the accuracy and completeness of the patient records and images? So the answer for this one will be like maintaining the accuracy and completeness of a patient records and images is crucial to provide high quality healthcare services. As a radiographer, I take several steps to ensure the patient records and images are accurate and complete. Here are some of the steps I follow. So you can mention the like steps one by one. So I'll just tell 7 points which I made over here. Proper identification. So one of the main point will be proper identification. Every radiographer should verify the patient's identification before starting the imaging procedure to ensure the correct patient is receiving the imaging. And second one will be documentation. All the radiographers should document all the relevant patient information, including the patient medical history, medications, and all the allergies. And the third one will be imaging quality. Radiographers ensure the imaging equipment is functioning properly and calibrated appropriately to produce high quality images, and also follow standard imaging protocols to ensure the imaging is done accurately and consistently. And the fourth point will be quality control. So all the radiographers perform regular quality control checks on the imaging equipments to ensure it is functioning properly and producing high quality images. So the quality control will be like in CT, if you're checking, most of the scanners will be doing QA check, that is quality assurance check, in the morning before they start scanning the patient. And if you are moving on to the fifth point, it will be archiving. So all the radiographers ensure that all images are properly archived in the appropriate locations, such as picture archiving and communication system, that's PACS. Every radiographer will be using that. So all the radiographers ensures that it's after the study is done, they push the images to the PACS and ensure that they are easily accessible for the other radiographers or medical professionals and other doctors. And if you're moving on to 6th point, it will be confidentiality. All the radiographers follow strict confidentiality protocols to protect patient privacy and ensure the patient records and images are not accessed by unauthorized individuals. And the 7th one will be accurate reporting. So this accurate reporting will be like, as I told before, like you will be sorting the patient according to history of the patient. If a stroke patient come, that patient will be needing the report of the scan immediately. So it's the duty of the radiographers to make sure that is assigned to some doctors to report as soon as the scan is done. And I think like that's it. Like you can add on some points to this by your research or doing, like you can ask with your friends and colleagues. As a conclusion, you can tell like by following all these 7 steps, radiographers can ensure the patient records and images are accurately complete and easily accessible for other doctors and medical professionals. We'll move on to the next question. So it'll be like, as a radiographer, can you provide an example of challenging case you had work on how to overcome the challenge? So they might ask you the questions like this to explain yourself, challenging case which you attended and like how you managed doing it. So I have made a short paragraph about this, like I'll read it out for you guys, like, and you can change, like I have given an example of an MRI patient and like you can change it to see to your X-ray patient like according to your wish. So I'll read out the answer which I made. Certainly, as a radiographer, I have encountered several challenging cases that required me to think critically and adapt to the patient's needs. One particular case that stand out to me involved a patient who was extremely claustrophobic and had to undergo an MRI scan. The patient was extremely anxious and was struggling to lie still in the MRI machine. Despite many attempts to provide reassurance and support, the patient was becoming increasingly distressed, and it was clear that we are not going to be able to complete the imaging procedure without some intervention. To overcome the challenge, I consulted the referring physician to see if sedation might be an option. After carefully reviewing the patient's medications history and current medication, the physician authorized the use of a mild sedative to help the patient relax. We then rescheduled the imaging procedure for the next day or the following day, and I made sure to provide clear and detailed instruction to the patient about how to prepare for the scan, including what to wear and what to expect during the procedure and what the sedation would feel like. And on the day of procedure, I made sure the imaging room was quiet and comfortable, and I provide the patient with warm blankets to help them feel more at ease. I also played calming music to help them feel relaxed during the procedure. With the support of this sedative and calming environment, the patient was able to complete the MRI scan without any further difficulty. We were able to produce high quality images and provide the referring physician with information they need to make an accurate diagnosis. Overall, this challenging case taught me the importance of effective communication and collaboration with other healthcare professionals, as well as the need of flexible and adaptable response to the patient's individual needs and challenges. Next question is like they might ask you also like how do you stay updated with the current advances in radiography and the imaging technology. So you can answer this as like staying updated with the current advances in radiography and imaging techniques is crucial for providing high quality healthcare services. As a radiographer, I take several steps to ensure that I am knowledgeable about the latest advances in radiography and imaging techniques. So like here are some of the points I follow. Like I made like around 5 points for that. Like I'll read it out for you guys. Continuing education. This continuing education, what we call it is in India is like CME, continuous medical education, and over here in UK it is called as CPD. So both are same. Like if in your if they're like in any of the profile they are asking about CPD, you can provide all your CME certificates and your details about that. So you can explain that briefly. Like I have attended regular continuous education courses, conferences, and seminars to stay informed about the new advances in radiography and imaging technology. These educational opportunities help in stay update and about the latest research technique and equipments. Next point will be professional organization. Professional organization, you can tell it as like back home, it will be like ISRT, like Indian Society of Radiographers and Technologists, and over here in UK it will be SOR, a Society of Radiographers. So all, if you are a member of this professional organizations, you will be able to get more resources and networking opportunity with the organizations. And you can also tell medical journals on that, and you can explain it like I regularly read medical journals and publications such as radiology journals of America or whichever journal which you are used to do, or like just find it out, like some of the journals which you are used to get in your place, or just tell about them. And other thing we can mention on this question is like your colleagues and experts. I regularly consult the colleagues and experts in this field of radiography and imaging technology to discuss new techniques and equipment and the best practices. So it's like if you have a senior radiographer, you'll be learning more from the senior radiographers. If you are freshly, you'll be getting more idea about the practical stuff from the senior radiographer. It's what they are mentioning about in colleagues and experts. Like experts can be like the software application specialist which used to come for installing a machine, or if you're having any problem with MRI or CT software, they'll be coming to solve that problem. So if they're on the department, you can go through or discuss with some questions or the doubts which you have. They'll be having more detailed idea about the machine and how it's working. More than the radiographers, they'll be knowing, I guess, because they are like undergoing many of the courses and like special techniques about like the machines and the procedures. And if you're moving on to the fifth topic, it will be like equipment training. So you can mention equipment training under this answer. I undergo regular training on new equipment and technology to ensure I am proficient in the using latest equipments and technologies. Move on to the next question. The next question is, how do you prioritize and manage your workload during a busy shift? As a radiographer, how do you manage and prioritize your workload during a busy shift? And you can point out, like I pointed out like 6 of the main points. So I'll read it out for you guys. As a radiographer, managing a busy workload during a shift can be challenging, especially when there is a multiple patients with different imaging needs. Here are some of the strategies which I use for prioritizing and managing the workload during a busy shift. And the first point will be prioritizing urgent cases. As a radiographer, I prioritize urgent cases that require immediate attention, such as patients with suspected fracture or stroke and other emergency conditions. And the second point will be multitasking. It will be like while working on one patient, I may simultaneously prepare another patient for the next imaging procedure to save time. And the third point is like effective communication. Communication with the referring physician, nurse, or other healthcare professionals can help in managing the workload. For example, I communicate with the referring physician about the urgency of a patient's condition or discuss how best to prioritize the patient imaging order. And if you move into the fourth point, it will be time management. And you can say it like, as a radiographer, I try to allocate the enough time for each imaging procedure while at the same time ensuring that I'm not running behind schedule. This requires a good planning and prioritizing the time managing skills and collaborating with the team. So as a radiographer, you'll be working in a department with a team. So it's always important to collaborate with other radiographers who is working along with you. So when necessary, I work with other radiographers to manage the workload, such as sharing the workload and duties to make sure everything is covered. So it's like in a hospital, if there is 2 scanners and one scanner is very busy and the other scanner is not that busy, you can share the workload with the other scanner. Actually, if you're like, if the other scanner is like running free, you can ask the other scanner to do this scan 1 or 2 scans for you, so that you will be like sharing the workload and you will make it easier for everyone. And the last and final point will be regular breaks. So as a radiographer, take regular breaks to rest and recharge your energy. As a tired or overworked radiographer, there is a high chance of leading it to medical errors. We'll move on to the 9th question. And it is, how do you communicate effectively with other healthcare professionals, including doctors, nurses, and other radiographers? And you can answer it as like, effective communication is essential for delivering high quality healthcare services. As a radiographer, I communicate with other healthcare professionals, including doctors, nurses, and other radiographers in the following ways. And you can point it out as like one by one. I have noted 7 points for this, and I'll tell it one by one. The first one will be active listening. So active listening is a crucial part of an effective communication. I listen carefully to what other healthcare professionals are saying, and I ask questions if I need clarification. The second point will be clear and concise language. I use clear and concise language to convey information accurately and avoid any misunderstandings. And the third point will be using appropriate medical terminologies. Medical terminologies are essential in radiography, and I use them appropriately when communicating with other healthcare professionals. This ensures that everyone understands the medical jargon and can work together towards a common goal. And the fourth point will be using proper channels. As a radiographer, I use proper channels to communicate, such as in-person communication, telephone, email, and digital messaging. I ensure the most appropriate method is used, and I try to avoid using jargon when communicating with individuals who are not familiar with medical terminology. Being respectful and respecting other healthcare professionals is an important when communicating. I show respect by actively listening, using appropriate language, and offering constructive feedback. If you're going on to 6th point, will be sharing information. As a radiographer, I share information and provide regular updates to healthcare professionals to keep everyone informed and update about the patient care. And the 7th and last point will be like teamwork. As a radiographer, working as a team is an important in healthcare industry. As a radiographer, I collaborate with other healthcare professionals to achieve the common goals, identify problems, and find best solutions together as a team. And by communicating effectively with other healthcare professionals, I ensure everyone is working towards the same goal of providing high quality care to the patient. Move on to the last question which I prepared, and this question is: can you discuss a time when you had to make an ethical or moral decision in your workplace? And the answer I prepared for this one is like, I will give an example answer for this question, and you can make your own answers for this and with your experience and your knowledge. We'll move on to the answer for this question. As a radiographer, there are many situations where ethical and moral decision making is required. One such incident that comes to my mind when I had to deal with a patient who has been referred for imaging but was not fully aware about the radiation exposure associated with the imaging. The patient had a frequent imaging studies and was concerned about the cumulative radiation exposure. After talking to the patient, I realized that the patient had not been fully informed about the potential risk and benefits of the imaging procedures. I had to make an ethical decision whether to proceed with the imaging, knowing that it might expose to the patient to unnecessary radiation. I explained to the patient the risk and benefits of the imaging and also informed the referring physician about the patient's concern. In this case, I decided to delay the imaging study until the patient was fully informed about the risk and benefits and had given informed consent. This decision was made to prioritize the patient's safety and well-being of the patient, and to ensure that the patient had all information necessary to make an informed decision. In the end, the patient was grateful that I had taken the time to explain the risk and benefits and allowed them to make an informed decision. This experience reminded me that as a radiographer, it is essential to prioritize the patient's safety and well-being while upholding the ethical and moral value of decision making. Okay guys, that are the 10 most likely questions which will be asking in the case of an interview of a radiographer in NHS and private sector. And if you think the video is informative, just try to share it as maximum to your friends and whoever is trying for a job in UK and other countries. It'll be helpful for someone. And if you like the video, just try to give it a thumbs up and subscribe to the channel. We'll meet you with some other video. Until then, bye.